Hello everyone. This mini lecture is on Yin Qiao San, also known as honeysuckle and forsythia powder. The formula is from the Cal formula list. I will summarize the pattern, a short patient case, 3 clinically important drug-herb interactions, and a practical management plan. Traditional use. Yin Qiao San belongs to the category release wind heat or early exterior heat. The formula is selected by pattern, not just by disease name. In this presentation, the goal is not to prove that herbs replace medication. The goal is to show how a practitioner thinks about benefit, risk, and communication with the patient's physician. Case patient. 28-year-old male with early sore throat, chills, feverish feeling, seasonal allergies, and prediabetes. Medicines. Metformin, loratadine, and acetaminophen. The pattern diagnosis is wind heat invasion. Tongue red tip with thin yellow coat, pulse floating, and rapid. This gives a reason to consider the formula, but it also creates the need to check her or his medication list before recommending treatment. Interaction 1. Yin Qiao and blood pressure medicines. Mechanism. Licorice can raise blood pressure and lower potassium, especially if repeated beyond a short acute course. Clinical significance. Low to moderate, because Yin Qiao San is usually short-term. Management. Identify high-risk patients, avoid duplicate herbs, and monitor symptoms and objective values when relevant. Interaction 2. Bohi, or aromatic herbs, and sedating antihistamines. Mechanism. Aromatic herbs may add dizziness or dryness in sensitive patients. Clinical significance. Low, mainly counseling and observation. Management. Counsel the patient on warning signs and coordinate with the prescribing clinician if the medication has a narrow safety margin. Interaction 3. New Banzai and bitter clearing herbs and metformin. Mechanism. Possible additive glucose lowering or GI upset in a prediabetic patient. Clinical significance. Low to moderate. Evidence is limited, but clinically worth monitoring. This interaction may be less certain than the first one, but uncertainty is still important because patient safety comes first. Management plan. Use only for the first few days of wind heat symptoms, separate from other drugs by 2 hours when practical, and stop if fever worsens or shortness of breath appears. I would also document the formula, dose, product brand, start date, stop date, and all current medications. If red flags appear, the formula should be stopped, and the patient should contact the physician. Conclusion. Yin Qiao San may be useful when the pattern fits, but the safest clinical approach is a short monitored trial, clear patient education, and communication with the physician and pharmacist. Thank you.